Good morning, everybody. As promised, here come conditions of the urinary tract for companion. All right, so just like everything we do, every system starts with its own terminology, and I know you guys know some of these. Cyst refers to the bladder, like cystocentesis. If we are using the term renal or nephro, those are both specifically referring to the kidney. Be cautious that we understand the difference between something being ureteral or associated with the ureter versus urethral. We see a lot more urethral issues in dogs and cats than we see ureteral issues. And then very importantly, one of the most common conditions we have of the lower urinary tract are stones. Those can be referred to as either liths or calculi. So cystic calculi or a nephrolith refers to a stone in that particular portion of the urinary tract anatomy. All right, big important topic that we need to cover that we'll hit a ton more of next semester in ClinPath, which is the term azotemia. If you see the term azotemia, that refers to a condition of elevated BUN and creatinine, both of which are measures that we see on a chemistry profile in the bloodstream itself. So that is measurable on a piece of paper. Hematuria, blood in the urine. Pyuria is white blood cells in the urine. Bacteriuria is bacteria in the urine, whereas pigmenturia is discolor of the urine. It can be due to hemoglobin, in which case it is hemoglobinuria. It can also be due to myoglobin, which is secondary to muscle damage. So how does one tell the difference between hemoglobinuria and hematuria? Because taking just that sample, it can look the same. The answer is centrifugation. So on this little chart right here, you can see that on the left-hand side, that is hematuria here, where after running it through the centrifuge, all the red blood cells have gone down to the bottom of the centrifugation tube, what's called the pellet. However, when you truly have hemoglobinuria here, after it is spun down, you still have redness left in the supernatant of the urine. All right, normal urine production for dogs and cats. I'm skipping forward there. Normal urine production is 1 to 2 mils per kilogram per hour. I'm going to try to move myself out of the way there. As I mentioned, myoglobin is discoloration of the urine. Myoglobinuria is discoloration of the urine from breakdown of muscle. It will often have a brown color instead of a red color. If we say an animal is polyuric, that means they're urinating more than what we would consider normal or excessive urination. Dysuria is painful or difficult urination. Stranguria is painful urination, and a lot of times these animals will just make a tiny amount of pee. Plaqueuria is frequent urination, whereas these bottom two terms are bad. Oliguria is a severe reduction in urine production, less than 0.5 mils per kilogram per hour, so a 50 to 75% reduction in urine production. And anuria is the absence of urine production, and anuric animals are in big, big trouble. There we go. All right, glucoseuria, sugar in the urine. My touchscreen is super sensitive today. Ketonuria is ketones in the urine. Nephritis is actual inflammation and or infection of the kidney. If it happens at the level of the glomerulus, because I know you all know your nephron drawing, it is called glomerulonephritis. If it happens at the level of the tubule, it is called tubular interstitial nephritis. Pyelonephritis is actual pus and inflammation at the level of the kidney. It is most commonly seen due to bacterial infection. Nephrolith is a stone in the kidney. Ureterolith is a stone in the ureter. A cystolith is a stone in the bladder. All right, there are a very few congenital conditions of the urinary tract in dogs and cats. One that we see probably most commonly in dogs is what is called an ectopic ureter. Ectopic simply means that it is grown in the wrong place. You've probably heard the term most frequently in terms of ectopic pregnancy in women, where the fetus and the embryo actually implants outside the uterus, or usually most commonly in the fallopian tube. Well, this can happen in dogs with where the urethra actually goes. If you look at this diagram here, we got the kidneys, we got our ureter coming down, and normally they are supposed to insert right in the trigone area of the bladder. Every once in a while, they don't do that. They come down and insert directly into the urethra. So what's bypassed there? Well, one of the sphincters to the neck of the bladder is bypassed. And so you end up with an animal that's just constantly putting urine into the urethra. So you get an animal that dribbles a lot of urine as a result of this. It's often diagnosed in young dogs because these puppies are very difficult to house train. They also commonly have a lot of urinary tract infections because you no longer have the bladder and the protective mechanisms of the bladder, such as mucus, to help prevent ascending infection up into the kidneys. Treatment for this is actually pretty cool. You can actually go in with a laser and basically increase the diameter of where that urethra is attaching. And many times, because it's right at that level of the sphincter, that will be fixative. Or a surgeon can go in and reattach this ureter into the bladder directly. Certainly, as with all congenital conditions, any animal that's diagnosed with this should not be used for breeding purposes. All right, some other congenital conditions, renal dysplasia. That means the kidney did not form normally while in utero. In cats, we see this as a consequence of panleukopenia infection. That's a feline parvovirus infection. These animals have very, very early congenital kidney disorder or chronic kidney disease early in life. We can also see polycystic kidney disease, which is exactly what it sounds like. There's many cysts within the kidney. We see this most commonly in cats, for sure. Persian cats and long-haired cats are overrepresented, but it is seen in some breeds of dogs. And then we have a condition called amyloidosis. And when you hear the term amyloid, think about protein. Amyloid is a form of protein. And some breeds, specifically Shar-Peis and Abyssinian cats, have an excess amount of protein deposited in the kidneys, and it leads to chronic kidney disease, or CKD, early in life, as well as really significant proteinuria. Let me move my slide. There we go. All right, so on the left side here, you've got an image. We have an image of a polycystic kidney, so you cannot see any normal renal architecture or structure, so there's multiple cysts within the kidney. On the right-hand side here, these are kidneys that have been affected by amyloidosis. So again, you can see a lot of that normal architecture as far as like the renal pelvis is kind of absent. There's lack of distinction between the renal cortex and the renal medulla. All right, we're moving on to UTIs. These are super duper common. Typical symptoms that we'll see are increased frequency of urination, smaller amounts of urination, accidents in the house. Often blood is noticed by the owner in the urine itself. And sometimes these dogs get really thirsty when they have UTIs. And we believe that is due to a toxin put forth by some bacteria that cause these UTIs that messes with that antidiuretic hormone. The bladder typically is considered a sterile environment, whereas the prepuce or the vaginal vault is not sterile. Therefore, most bladder infections are ascending, so they move up the urethra into the bladder. Clinical notes. Number one is that true urinary tract infections are not common in cats that are less than 10 years of age. Can they happen? Yes, but by rule, they are not common. Likewise, true urinary tract infections are not common in neutered male dogs. They can happen, yes, but they are not common. All right, now with respect to UTIs, I'm going to move my little head bubble up to the top here so you can see better the wording on the page. Actually, I just got rid of my head bubble. I don't know where it went, but we'll roll with that. Female dogs are overrepresented. And why is this? Is because of anatomical differences. That urethra is shorter and more narrow or wider, pardon me, and so it is much easier for bacteria that live in the vaginal vault to gain access to that bladder very, very easily. Infections can be due to primary bacterial contamination versus things that are specific to the animal that we're discussing. And host factors include age. So young dogs whose immune system is not as well developed are more likely to get UTIs, but other things as well. Diabetes, where we're spilling tons of sugar into the urine. Sugar is great for bacteria to eat, so to speak. So diabetes, kidney disease is also a big one, as is immunosuppression. Now, in female dogs, and shockingly, this is a bulldog butt on either side here, female dogs that have a redundant skin fold over their vaginal vault, over the labia there, that little skin fold traps moisture, and it allows for bacterial overgrowth to occur very, very easily. Likewise, this little bulldog butt, you can see her little hoo-ha is touching the ground here. So that makes for very easy access for bacteria to gain access up into that vaginal vault and then get into the urinary bladder. This little diagram up here, this is a surgical condition that if you have excessive skin folds over that vulva, you can actually do a vulvoplasty or a lift essentially of that area. So the actual vulvar opening is not directly contacting the skin overlaying to kind of give your innie an outie, so to speak. All right, so UTI diagnosis. UA is super important, of course. Cystocentesis samples are the gold standard when diagnosing UTI. CBC chemistry can be helpful, but there's not a lot of specific items on that CBC chemistry outside of possibly white blood cells, but they're not always elevated if you have a UTI, and the presence of elevations in BUN and creatinine. Recurrent UTIs are worthy of obtaining a urine culture, sending that urine off to a lab and growing, see what bacteria grows out of that, and see what antibiotics it is specifically sensitive to. If we have animals that are having recurrent UTIs, those are animals that are really important to image. So obtaining x-rays or doing an ultrasound of the urinary bladder and kidneys can be quite beneficial to look for things like tumors, look for things like stones as well. As a general rule, uncomplicated urinary tract infections usually respond within a week to maybe 2 weeks at most of appropriate antibiotics. So what if we have stones? And we do often have stones. Stone formation is dependent on pH of the urine, concentration of the urine, and saturation of the urine with minerals, essentially. Chronic UTIs often can lead to stone formation. Now, clinical signs associated with bladder stones or urinary tract stones, sometimes they're not there. Sometimes the animals have them forever and rarely are symptomatic, but sometimes they can also become life-threatening if those stones block the urethra and we have a true urinary tract obstruction. Most commonly, symptoms of stones are most similar to those that we see with UTI. As I mentioned, UTIs are a risk factor. What can happen is if you get a lot of bacteria, they can start to clump together. And a little clump of something is often called a nidus in medicine. And with a bacterial nidus and supersaturated urine with minerals that is really concentrated, those minerals will start to deposit around that bacterial nidus, and slowly over time, they'll develop a stone. There are also some animals that have genetic predispositions to forming stones. Dalmatians are the poster child for this condition. Dalmatians have a gene mutation which prevents their liver from properly converting uric acid, and therefore they are prone to what are called urate stones. Now, there's lots of different types of stones, and we're going to hit them again in clinical pathology. But by far and away, struvite stones, are also called triple phosphate stones, are most common in dogs and in cats. But there are also things like calcium oxalate, cysteine, urates, and silicate stones that can occur. I also have dogs sitting right by me, and I'm going to show you them. There's Pip and Lincoln. Hey, Pippy. And Lincoln back there. So if they start barking, that is why. We diagnose stones with x-rays, ultrasound, and urinalysis. Sometimes on UA, you can actually see small crystals that are consistent with the type of stone. Most of the time we can see them on x-rays. However, there are several types of urinary stones that are not radio opaque or visible on x-rays. Now, treatment of stones, surgery is definitely the most common for very, very large stones, but diet is able. Some Hills and Royal Canin, they make special prescription diets that are to dissolve some types of stones, particularly those struvite stones are most able to be dissolved with dietary management. And then rarely tertiary referral centers or academic institutions, you may see them do what's called lithotripsy, which is using a sound wave essentially to break up the stone. They do this quite frequently in human medicine, but it's not very common in veterinary medicine. And animals that get stones have a very, very high rate of recurrence of stones. So here's just a couple visual images of what bladder stones may look like. Obviously, in this photo up here, we've got one giant urolith or stone. This one down here, we've got multiple giant stones, and you can see they've actually been rubbing on each other for a period of time because they've smoothed the edges out. If you were to go palpate this dog in this picture, this would probably feel like a bag of marbles, essentially. Like it really sometimes can be very, very distinctive feel to it. Grossly, here's what some of these different urinary stones look like once you take them out of the body. It is, however, very hard to just say what type of stone it is based on visual appearance. In order to do that conclusively, those stones do need to be sent to a lab for evaluation and testing. Okay, another small break. I keep managing to delete my face, the picture-in-picture, off of the slide, so I'm stopping, going back, and I'm about frustrated with it, so I may just leave my little head bubble exactly where it is. One important point about urinary stones. Male dogs, you think about that male urethra. That urethra is coming, there's small stones here in the bladder, here's the urinary bladder. That urethra runs all the way over the brim of the pelvis and back down through and out the prepuce. So male dogs are way more likely to become obstructed from stones than female dogs are. Two spots where male dogs love to get stones stuck. One is right here at that pelvic brim. The other is right here underneath the os penis. So when dogs or cats get obstruction of the urinary tract due to stones or crystals, this is an emergency because think about what the kidneys do is they filter out toxins. They're a major way that the body gets rid of potassium. And when that urinary tract becomes obstructed, that potassium level goes through the roof in a pretty short period of time. It's usually about 10 to 12 hours of full obstruction. These guys can get a life-threatening hyperkalemia or elevated potassium level. And once that happens, this now has become an emergency. And so these guys need to be either A, unobstructed or push these stones back into the bladder with flushing them backwards, or B, they may need surgical intervention. So what do we do in terms of surgery of the urinary tract? Obviously, uroliths are the most common reason we are doing any surgery on the urinary tract. Number one, we can do a cystotomy, so making an opening into the bladder, which is then closed surgically. Number two is we can do a urethrostomy, or that is an incision being made into the urethra itself, where we create a permanent or temporary hole in the urethra. And many times we'll do this with male dogs, right at the base of the penis, where we basically give them a new pee hole so then they can pee like a girl. And that is somewhere around the os penis or just behind the os penis, so future stones cannot get stuck there. You can do a urethrotomy where we open it and then we close it. And the urethra is super delicate, though. Think about how teeny tiny the ureters were in our cats. Like, the male urethra is vascular. It reportedly heals very well, but I will tell you, most of us ER doctors and general practitioners don't really love to cut urethras if we can avoid it. We don't actually often remove true kidney stones. People will say the term kidney stone. Clients will say it all the time. They are usually talking about bladder stones, not kidney stones. But there are stones that can get up in the kidneys. And when they get up there, we don't usually do much about it unless they are actually causing problems. And if they are truly obstructing the renal pelvis, and you can end up with what is called a hydronephrosis, or the back pressure from the urine formation gets so elevated it compresses that renal cortex and essentially makes the kidney just like a bag of pee in there. Or if we get stones in the ureter, those are typically cases that your average general practitioner is going to refer to a surgical specialist. We do not like to mess around in those areas. All right. Let's talk about general kidney disease. You've probably heard the term. Many of you may have had pets that had some form or fashion of kidney disease. I encourage you to think about the kidneys as having two big jobs in the body. One is to filter and excrete toxins and waste products from the body. Number two is to help conserve and preserve water. Your kidneys functioning well are a big part of why we don't get dehydrated. When kidney function, we have to change positions here, starts to decline, two things will happen. Their ability to filter out those toxins decreases, and this will result in azotemia, or elevations in BUN and creatinine in the bloodstream. Number two, they will lose their ability to conserve and preserve water. And when that starts to happen, what we start seeing is we see an animal that has an increase in thirst and an increase in urination. The technical terms for that are polyuria and polydipsia. All right, so there's lots and lots and lots of causes of kidney disease. Our favorite, idiopathic, but there are also inflammatory diseases, so things like glomerulonephritis, interstitial nephritis, and pyelonephritis. So chronic infection of the bladder and kidneys can cause inflammatory disease. We talked about heartworm as a potential cause of glomerulonephritis. Amyloidosis, which is that excessive protein deposition in the body, in the skin. It doesn't just happen in the kidneys, it happens in the skin. That's a big part of why Shar-Pays have all those wrinkles. Polycystic kidney disease can be a cause of kidney disease, as well as renal dysplasia or poorly formed kidneys. There are a boatload of infections that can cause kidney disease. Lyme disease, like we've talked about, leptospirosis that we've talked about. Also a lot of toxins, and I have multiple lectures for you guys on toxins next semester in clinical pathology. Oh, here's the list of predisposing factors. So here are all different types of infections that can cause or lead to chronic kidney disease in dogs. Parvo's among that, adenovirus, babesia, Rocky Mountain spotted fever, lepto, trypanosoma, E. coli, chronic UTIs, also different types of cancers, leukemias, lymphomas, histiocytosis, inflammatory disease, overwhelming inflammatory disease, pancreatitis, prostatitis, immune-mediated diseases, DIC, as well as a boatload of other causes. The one down at the bottom there under other causes that I do want you to pay special attention to is severe prolonged hypotension, low blood pressure. next semester, as we get into vet hospital, we are going to be doing things, i.e. anesthesia, which almost every anesthetic agent has the potential to cause hypotension. And so paying attention to blood pressure during anesthesia is incredibly important, particularly in animals that may have pre-existing kidney disease. All right, cats. So here's our kitty cats. Polycystic kidney disease, that is one of those genetic inherited diseases. Amyloidosis, as we mentioned in Shar-Pei's, but Abyssinians are the big cat breed that gets this. Infectious causes, cancerous causes, inflammatory causes, and miscellaneous causes. But there's a lot of things that can lead to kidney disease. So how do we diagnose it? Number one is CBC chemistry, getting an assessment of that BUN and creatinine levels. We monitor blood pressure. Often animals that have chronic kidney disease do have systemically higher blood pressure, and we do imaging. There is actual staging of kidney disease that is out there. It is called the International Renal Interest Society, or IRIS staging, and there are 4 stages. This little chart over on the side outlines them for you. And they are based on serum creatinine, which is a blood measurement, urine-specific gravity, which we measure with a refractometer, SDMA levels, and SDMA is like an early renal biomarker. It will become elevated sooner than our creatinine and BUN levels will, as well as clinical symptoms associated with it. If you have further interest in renal staging, I've left you a website link there. And what do we do to treat it? Well, kidneys, unfortunately, are an organ system that once they are damaged, it is very hard for them to repair themselves. So oftentimes we have some comorbidities or secondary disease processes that happen. Hypertension can lead to and be a byproduct of chronic kidney disease. UTIs are a common factor in animals that have chronic kidney disease as well. So it's super important that they have some form or fashion of fluid therapy. So they have all the water that they want to drink. Some of these animals require subcutaneous fluids done either in clinic or at home. And the sick animals with kidney disease often benefit from IV fluids short term. We optimize their diet. So there are some prescription diets that are formulated to help support kidney function. Some of these animals do need potassium supplementation because those tubules don't work properly. They can actually lose excessive potassium. Phosphate and phosphorus are big factors in causing mineralization of the kidneys. So many times we will give them phosphate binders. Antihypertensives are medications that help to lower chronically elevated blood pressure. And when you start to have kidney disease and those kidneys start to fail, those toxins build up in the bloodstream and they have a negative effect on appetite. You just feel sick. So a lot of times we will start these animals on appetite stimulants. There is such a thing as kidney transplants in cats, and it is not common. I just want to put it on your radar so that you know that, yes, it is in fact a thing. It is only done in 3 locations here in the United States: University of Pennsylvania Vet School, Wisconsin Veterinary School, and Georgia College of Veterinary Medicine. Animals that are potentially in the realm of qualifying for this, they have to meet very strict health requirements. This is incredibly expensive. It runs about $30,000. And one of the conditions of having your pet go through this process is that the cat that is utilized for kidney donation must be adopted by the family whose cat is getting the kidney donation. So it is possible, but man, it's a lot to think about. All right. So a lot of chronic kidney disease that happens slowly. So what happens when kidney disease occurs quickly? What happens when there is a very sudden insult to that kidney? In those situations, we call it acute kidney disease. And what we see in acute kidney disease, unlike chronic kidney disease, where we see an excess of urine output because the kidneys are no longer holding onto water, when you have an acute kidney injury, you typically get a sudden decline in urine production. So urine output drops quickly. There are multiple phases of this. The initiation phase, which is the actual insult, where the glomerular filtration rate, remember our glomerulus in our nephron diagram, decreases. But many times we don't see obvious clinical signs. If we can identify the cause at this point, it is important that it gets removed and treated to prevent further disease progression. So if it is acute hypotension, we have got to correct the hypotension. There's also the extension phase where the kidney insult continues. And as a result of chronic hypoxia, remember how needy those kidneys are as far as their oxygen demands. They require about 25% of the blood flow to be happy. Glomerular filtration rate continues to tank, and the cells of the kidney, the glomerulus, and particularly the kidney tubules, start to go apoptosis and necrosis, so programmed cell death, and they start to die. And then we have a maintenance phase, which is where the glomerular filtration rate stabilizes as kidney blood flow improves, and the cells, as best they can, start to repair themselves. We might, at this point in time, start seeing symptoms of uremia or elevated BUN and creatinine, or buildup of byproducts in the bloodstream that the kidney normally filters out. And what those will look like is vomiting, diarrhea, and changes in their drinking habits or their urination. And so this maintenance phase, unfortunately, is when we typically diagnose most acute kidney injuries. And then we have the recovery phase, and this can last for months to years. Glomerular filtration continues to increase as cells start to repair themselves, but progression can also result in fibrosis or scarring of those kidneys. And so a lot of these patients that have some sort of acute kidney injury go on to develop some degree of chronic kidney disease. So it's really important that you take care of those kidneys for life after this type of event. All right, acute kidney injury requires acute or prompt care. The prognosis for acute injury is very vast. It is a spectrum. It's much like pancreatitis. Some cases of acute kidney injury are very mild and readily reversible. Some are catastrophic and lead to death. So how treatable something is depends on being able to find the underlying cause and being able to fix it. With acute kidney injury, we do a lot of fluid diuresis. So these are hospitalization cases where they're on IV fluids. They are monitored very closely for urine output, weight, and they're treated for the underlying cause. Now, there are some very aggressive options in terms of kidney injury, particularly acute kidney injury, meaning that there is dialysis, hemodialysis for veterinary patients. You guys have probably all heard the term dialysis. You probably can connect it to kidney injury in people. But what happens with dialysis is we've actually created a machine that an individual is hooked up to, and that machine basically takes your blood out of your body, runs it through a dialysis machine, which is in essence an artificial kidney, and then pumps it back into you. It is incredible therapy, treatment modality. I am a former dialysis patient. I can tell you it likely saved my life. But it is ridiculously expensive, again, and it is not readily available. There are a very small, probably about a dozen to 20 dialysis centers for hemodialysis in veterinary medicine, and the cost of hemodialysis is, again, it is cost prohibitive for most clients. So it can be anywhere from $15,000 to $30,000. That patient has to meet very strict qualification parameters in order for it to be effective. I would tell you that it is most commonly used and something called total plasma exchange, or TPE. Those modalities are most often used with very acute toxic injuries, things like massive overdose of ibuprofen in dogs. But again, its use is very limited. I can think of one patient that I sent to LSU in the last 5 years for an acute Aleve or naproxen sodium ingestion. All right, so causes of azotemia. Again, azotemia means elevated BUN and creatinine in the bloodstream. It is really important that you understand the three big categories of things that can cause an azotemia on paper. They are pre-renal causes, renal causes, or post-renal causes. So pre-renal being before the kidney, renal being the kidney, post-renal being behind the kidney. Pre-renal causes of azotemia are those things that affect blood flow to the kidneys. So hypovolemia or low blood volume. Dehydration is far and away the biggest cause of pre-renal azotemia. Hypotension, congestive heart failure, sepsis, or a physical obstruction to the blood flow, such as a clot or a thrombus in the renal artery. Renal causes of azotemia are things that directly affect the kidneys, and they can be infectious or non-infectious. So leptospirosis versus antifreeze toxicity, or tumors, trauma, other toxicities. And then we have post-renal causes. So post-renal is behind the kidneys. What is behind the kidneys? The urethra. So post-renal causes are usually urinary tract obstruction due to stones or crystals, or things like a ruptured bladder secondary to trauma. The bladder sits behind the kidneys. If the bladder is leaking into the abdomen, the BUN and creatinine will go up, and that is a cause of post-renal azotemia. So how do we tell the difference between those three? And this is a very important point I want you guys to understand. If we have a post-renal, or so a problem behind the kidneys with the bladder or the urethra, and these two causes are almost always going to be trauma causing bladder rupture or urinary tract obstruction. Those are pretty evident symptoms from a physical exam or minor ultrasound evaluation. Simple, easy. The bladder is huge. The animal is straining to pee. You don't see any pee coming out. So those are post-renal. Now, renal versus pre-renal can be a little bit more difficult. Is this animal just dehydrated? Does it have an acute kidney injury? Or a lot of times it's got some component of both. The way that we tell the difference between those two is to get some urine and check the urine specific gravity. If the kidneys are working well and an animal is just dehydrated, kidneys not only filter out toxins, but they conserve and preserve water. So if they're functioning well and the kidneys are doing their job, they should have a concentrated or high urine-specific gravity. So we put urine on the refractometer. If it's greater than 1040, that is a pre-renal azotemia. If the urine specific gravity is decreased or the same specific gravity as we would expect blood to be, which is about 1007 to 1014 on that little scale in that refractometer, then we have a renal azotemia. All right, so terminology of urine specific gravity. I'm going to try to move my head out of the way again, small, and I did. If urine has a specific gravity greater than the density of plasma, that is greater than 1030 to 1035, we call it hypersthenuric. If it is the same as plasma, so 1007 to 1012 range, we call that isosthenuric. That means urine is not being concentrated. The kidneys are not doing their job. If urine has a urine-specific gravity that is less than 1007, we actually call that hyposthenuric. So the kidneys are doing something here, actually. If it's super low, the kidneys are actually actively diluting that urine. So less than 1007, hyposthenuric, 1007 to 1012 is isosthenuric, and this is bad. If it is greater than 1030 to 1035, that is hypersthenuric. So important statistics to know, and this one is important. The kidneys begin to lose their ability to concentrate urine once they have lost about 66% of their nephrons. Now they begin to lose the ability to appropriately filter out BUN creatinine at about 75% loss of functional nephrons. So functionally, what this means is that you are going to see changes in an animal's specific gravity before you will see changes reflected on their chemistry panel. All right, cancers and tumors of the urinary system. All right, small handful of cancers and tumors of the urinary system. By far and away, the most common tumor of the bladder and the urethra is called a transitional cell carcinoma. So that is the most common tumor of the lower urinary tract. There are cancers and tumors of the kidneys themselves. Renal carcinoma is most common, followed by nephroblastoma, which is generally a tumor of young dogs. Most things that have blast in them mean they're young in age, or renal lymphoma, which is common in cats. None of them are super common, though transitional cell carcinoma is most commonly diagnosed in clinical practice. All right, save this for last. This is the most frustrating condition of dogs and cats with respect to their urinary system. This is the syndrome that we tend to rename. You can hear it called Pandora system. You could hear it called feline interstitial cystitis, or FIC. I am going to refer to it as feline lower urinary tract disease, or FLUTD. It is incredibly common. It is incredibly frustrating to deal with. It is a recurrent disorder. We do not understand it very well. It is potentially very expensive for clients to deal with, and it is also potentially life-threatening. Welcome to the world of FLUTD. All right, there is no definitive breed predisposition. There's no definitive sex predisposition, meaning males and female cats are equally affected. These guys end up developing a substantial amount of inflammation and crystals in their bladder. Those are usually calcium oxalate, magnesium, ammonium phosphate, or what are called struvite or triple phos crystals, or urate crystals. And it causes a heck of clinical syndrome in cats. They are uncomfortable. They are straining to pee in the litter box. They are peeing small puddles all around the house. And then when male cats are affected, I would rather have a female cat as a client personally than a male cat with this condition, because male cats, when you fill up that teeny tiny little urethra with crystals and mucus and inflammatory cells and red blood cells, you end up with a perfect storm for urethral obstruction. I have an intact male tomcat whose penis is floating just above my head. You can see his spiky little penis. You should not ever be able to see the penis in a male awake cat. They just will not show it to you. You will not be able to exteriorize it like you can with a male dog. If there is a penis showing in a male cat, there is your problem. Again, UTIs are not common in young cats. Feline lower urinary tract disease is exceedingly common. Therefore, I will argue that it is probably UTI in a young cat is often overdiagnosed, and we tend to put these guys, and I've been guilty of it too as a general practitioner, well, let's give them some pain meds, let's give them some antibiotics. And this condition sometimes is self-limiting, so the symptoms go away with that treatment, but they probably didn't need it to start with. So here we go. Let's talk about urinary tract obstruction, because this is the life-threatening part of this disease. The male cat penis is super short and super delicate, and its urethra is teeny, 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 tiny. Hopefully you had an opportunity to look at our male cats in lab and how small that penis is, and imagine the tiny little tube that's running in the middle of that. That becomes blocked with crystals and inflammation, and you get a gigantic bladder, and that bladder wall and its transitional epithelium will resorb the things that the urinary tract is normally getting rid of, in particular that potassium. So urine, major excretory pathway of the body. When you cannot pee, A, it hurts. B, the metabolites and electrolytes get reabsorbed into the bloodstream. Your BUN, your creatinine, and your phosphorus elevate. But very, very importantly is the resorption of potassium. Normal potassium range is about 3.5 to 5.5. Now, when potassium starts to get above 7 on our chemistry panels, the heart and the muscle do not want to work well. So, what happens with excess potassium is, think about your membrane potential of your muscle cells, membrane potential of your nerve cells. The heart has nerve. The heart muscle and the skeletal muscle both have potassium and calcium and muscle and nerve that is critically important to their function. But with elevated potassium, you tend to get muscle weakness and electrical conductance to abnormalities in the heart. So we tend to see really specific changes in the EKG readings. You all hopefully know your P, QRS, and T waves by now and what they stand for. Well, when potassium gets really, really elevated, the T wave starts getting very narrow, as you can see in this second little diagram. So here's normal, here's our narrow P wave, and it starts getting really, really tall. When we get even greater levels of potassium, the P to QRS complex duration gets lengthened and the P wave amplitude decreases. And then as potassium continues to elevate, we will get P waves that are basically absent. You'll get wide and bizarre QRS complexes, and you still have these really crazy T waves. And notably, you will get this very pronounced bradycardia. This is one of the reasons why it is so critical that you understand what your normal values are in terms of heart rate. If you have a cat that comes in the door with a heart rate of 80 and a rock hard bladder, well, it is a blocked cat. And that, if we leave it uncorrected, will result in death in a pretty short period of time. The only good thing about this is that it is a pretty easy diagnosis. Clinically, you can put your hand on their lower abdomen and you can feel that painful bladder. The cat may lose its mind, or it may be teetering on the verge of death, in which case it doesn't put up much of a fight. Clients often don't recognize what is going on, and they present these cats with the complaint of walking funny or acting painful, or they think they're constipated. When you start asking history questions, a lot of times you will find that these cats have been vomiting through the day too, and that is a pain reflex. They are so painful that they are puking. Imaging is important. It is important that these guys do get radiographed to look for the presence of stones. They are not as common in cats as they are in dogs, but they do occur. So if you unblock them and hospitalize them, but you have a stone and you didn't diagnose that, the second you pull that urinary catheter, well, anywhere from 12 hours to 12 days later, that cat is going to be blocked again. These guys can come in very bright and alert, and they don't act like much is wrong except their bladder and belly hurts, or they can come in obtunded, laterally recumbent, cold. And what is good about a cold cat? All right, so what do? We put IV catheters in these guys. We start getting them fluids. We don't want to bolus them fluids if they're cold. We don't do that to cold cats. We will kill cold cats with that. But if their potassium level is high, it is really important that we stabilize these guys prior to sedation and anesthesia, because we can kill them with our sedation and anesthesia. So what can we do? Number one is we can give them insulin, IV insulin, very small amount. Will push potassium very quickly into cells. Insulin is a cellular gatekeeper for potassium, just like it is for glucose. Now, when we do that, we can also, and will also, bottom out their glucose. So it's very important that you follow that up with IV dextrose. we can give terbutaline, which is a drug that also has the effect of pushing potassium into cells. And I particularly like to give calcium gluconate because the calcium is good for the heart muscle and it is cardioprotective. And we give that slow IV over about 15 minutes while we are watching the ECG and to help to stabilize their cardiac conduction system before anesthetizing them. Obviously, we give them pain meds and we get them nausea meds, and we need to get them unblocked pretty darn quickly. So this is a photo of unblocking a male cat. Obviously, they don't do this willingly. They have to be sedated or near death in order to allow us to do that. It is really important that this be done with skilled hands and a small catheter. They make catheters that are specifically for this purpose. This person here is unblocking with what appears to be just a regular IV access, a 22 gauge, which is perfectly fine. But it is really, really easy to tear or further damage a urethra when you are trying to flush these plugs back into the bladder. Long term, what do we do? Well, these guys, depending on how bad they are when they come in, they're probably going to be in the hospital for a couple days on fluids until their electrolytes and BUN creatinine levels have resolved. These guys have to have a long-term diet change, prescription diet for the rest of their life. They need to be on pain meds. Laser therapy can be beneficial for the bladder and the urethra. Antibiotics are a big question mark because we know that there is not a very high incidence of UTI with urinary tract obstruction in cats. However, there can be a high incidence of urinary catheterization and an iatrogenic, which means that we caused it, UTI in these guys. So if I put them on antibiotics personally, I am usually waiting until I have removed that urinary catheter prior to starting antibiotics. We do also put them on urethral antispasmodics and sometimes behavior medications like amitriptyline or a sedative called acepromazine can actually help with just general stress level. This is a condition that we do think that stress can play a role for these cats. Many times when you start asking them questions, the clients that is, about changes in the household, cats will block shortly after another cat comes into the house or a new person comes into the house or a recent move. So we do think that stress, physiologic, emotional stress does play a role with this condition, but I'd be lying to you if I told you anybody has figured it out. Now, recurrence of this condition is unfortunately quite common, and these hospitalization stays can be incredibly expensive for clients. So when we have cats that repeatedly block, or we have a cat whose urethra is torn in the process of unblocking them, they end up being recommended for a surgical procedure called a perineal urethrostomy. And this is the ass end of a cat who is probably, if I remember correctly, he's like 5 to 7 days post perineal urethrostomy. And what this condition, the surgical procedure is a partial amputation of the penis itself, and they basically cut off a part of the winky. They take that urethra and you have your tube and they open it up and they do what's called splatulating it, which is designed to create kind of a wider and shorter urethra. And if you can look on this picture here, like the pee hole is right about here. The sutures are right around this area right here. And so the urethra is in effect then sutured down to this area to try to make it wider and shorter to try to minimize the chance of this cat blocking again. And this surgery, it does work a lot of the time. However, it does not, it is a symptomatic treatment to prevent the most life-threatening complication of this condition. So it hopefully eliminates the potential for them to obstruct. What it doesn't do, the surgery, is it doesn't do anything to treat the underlying cause of the bladder issue in the first place. So these guys still need to eat special diet. I still, unfortunately, have seen a couple cats that have had this surgery go on and block again. And let me tell you, as an emergency vet, there is nothing I like less than having to try to unblock a cat that has already had a PU surgery because, man, we just don't have a lot of good options for these guys. But that being said, that will be the end of this lecture. Thanks for watching.